Which healthcare system is objectively better, Canada or the United States?
What does a better healthcare even mean?
Our previous video comparing cost of living between US and Canada has sparked a big debate on this. Some say that they'd better have a free but overburdened healthcare, and some would rather pay thousands of dollars just to get what they need today instead of 2 years from now.
Turns out it's not as simple as that, and we have some mind-blowing numbers to show you.
Let's compare the two healthcare systems and evaluate all pros and cons. And if we miss anything, you know what to do.
Comment below.
First, let's acknowledge that both countries are very different demographically, geographically, and culturally. And this has a tremendous effect on how their healthcare systems are designed and operate.
The United States and Canada allocate a significant share of their GDP to healthcare, but US spends a bit more. Both countries spend more than the OECD average of 9.7%.
There are a few issues with these numbers. First, Canada is still among the top spenders, even though its healthcare is structured similarly to many other European counterparts who spend much less on healthcare. And many might say that these countries potentially achieve much better healthcare results than Canada. And you'll know why in just a bit. Second, USA is an absolute leader in spending in healthcare.
Naturally, we would think that the more you spend on something, the better the outcomes, right?
Well, not quite.
So how do you know what's a good healthcare system?
According to the global healthcare community, the healthcare system success can be measured in three main elements: child mortality, life expectancy, and cost versus benefit. So let's see. This is how our child mortality rates compare to the OECD average. The number for both US and Canada might look higher. That's because they measure it differently. Both US and Canada register a higher proportion of babies weighing less than 500 grams who have low odds of survival. That leads to higher reported infant mortality rates. In Europe, on the contrary, if a baby is born too early or too small and doesn't meet these conditions, it might not be included in their infant mortality statistics at all, leading to lower rates. So it's tough to say whether mortality rates is meaningful to look at in isolation.
What about life expectancy?
Here's what our life expectancy numbers look like. This number is more standardized. And that's where we see a glaring difference. Canadian life expectancy at birth is nearly 5 years longer than Americans. American life expectancy is also below OECD average and worse than countries like Turkey and Colombia. Americans have some of the lowest life expectancy in the developed world.
Looking at these two measures, we might infer that Canada's healthcare is much better.
Not yet. That's where we want to look closer at the cost versus benefit aspect, which essentially answers the question of, does the benefit of your healthcare exceed the costs associated with it? And we don't just think about it in terms of dollars. Time spent and stress associated with healthcare are the currency worth considering too.
So this is what the country's spending on healthcare looks like in Canada and the US per person. This includes both private and public spending. The first thing we notice is that in the US it's double the amount. But what do these numbers actually mean? Let's unpack the costs.
The Canadian system operates on what's known as a single-payer model, where about 70% of healthcare is publicly funded through taxes. Think of it as a massive public insurance plan that covers every Canadian unconditionally. The remaining 30% is private, mainly for services not covered by the public system, such as most prescription drugs, vision and dental care, and some other services that can be classified as non-urgent or non-essential.
So this is how much the government spends per person on healthcare. Public funding means it's our tax money that funds hospitals, doctors, medications, and government programs. There are some government programs that extend coverage for the private healthcare to specific groups like seniors, children, or low-income families, or province-specific healthcare plans. When we say private funding, it usually refers to private insurance premiums paid and out-of-pocket medical expenses.
Private insurance is common among most of the Canadian working population. It can be purchased separately or sponsored by the employer on a monthly basis to cover anywhere between 50% to 100% of the private healthcare costs. So if we were to look strictly at numbers, this is the per capita spending on healthcare in Canada. But that's not how much each of us personally spends on healthcare. The Fraser Institute tried to deduct that, and here's what they've come up with. A Canadian earning an average salary of $55,000 will spend $5,600 on healthcare via taxation. What's curious is that the Canadian tax system is progressive, which means that the higher earners will pay substantially more for healthcare than low-income earners. For instance, if you or your family is making $147,000 annually, your healthcare spending will amount to nearly $17,000 based on the proportion of tax that the government puts towards healthcare.
That's the money that Canadians end up spending regardless of whether or not you actually have used healthcare services in any given year, since that's baked into your federal and provincial tax.
It's worth noting, though, that should you need medical assistance, you will get help and free treatment, as long as it's medically necessary, no matter whether it costs $5,000 or $25,000.
The American system, in contrast, is rather curious. We all naturally think that American healthcare is dominated by the private healthcare, but it actually does have a significant public healthcare system, and if we look at public versus private healthcare spending, it's almost 50-50.
Nearly half of the American healthcare spending is, in fact, on public healthcare.
Public healthcare primarily covers programs like Medicare and Medicaid. They cover specific groups such as seniors, low-income families, and individuals with disabilities. According to the Census Bureau, nearly 38% of Americans receive one or both. Medicare is a federally sponsored program that covers hospital stays, outpatient services, and prescription drugs for seniors and persons with disabilities. Medicaid is meant for low-income families, jointly sponsored by state and federal, and it covers dental, vision, and long-term care and varies by the state.
Similarly to the Canadian public healthcare, the American healthcare is primarily funded through taxation, but also it has other additional sources and allocations. For an average American earning an average salary of $64,000 annually, approximately $900 is directly contributed to the Medicare through payroll taxes, plus the portion that the employer matches, totaling to $1,800. Self-employed individuals will pay the full $1,800. How much each American contributes to Medicaid via taxation is apparently harder to calculate because the number depends on the state and how much that specific state cares about funding healthcare. But the estimate that we were able to get is around $2,500, which makes up a total of around $3,400 that Americans spend on public healthcare in taxation. Some other methods of calculation say that this number could look a lot more like $6,200, so that's the range that we're looking at.
But wait, even if you are covered by one of these systems, there are still out-of-pocket expenses. Not a single program covers healthcare services in the US fully. And this is where it gets really complicated. There are still monthly premiums that range from $150 to $500 a month. There are also deductibles and co-payments depending on the type of service you would receive.
Simply put, no medical service or appointment will be free in the US, whether or not you have public healthcare coverage. From doctor appointments to blood tests to x-rays and hospital stays, everything has a price.
Private healthcare in the US accounts for the other half of American healthcare spending. In fact, approximately 65% of Americans hold a private health insurance, with 53% receiving employer-sponsored plans.
And that's where the nightmare begins.
In 2023, the average annual private insurance premium for single coverage was $7,900, with employees contributing about $1,400. For family coverage, the average premium was $22,000, with employees paying approximately $6,100.
But that's not all. There's also a deductible on each insurance. That is, if your healthcare costs are under a certain amount, let's say $1,700, the insurance does not even kick in. There are also things like co-payment and co-insurance. Also, you need to seek permission from your insurance company if you want to do an expensive procedure. Otherwise, you risk not being covered. Oh, and there's also a network. So Americans must make sure that their medical professional has a contract with the insurance company that they're working with, and if they don't, you also pay more.
It's unnecessarily complex, really. But here is an example for how the American private insurance plays out. Let's say you visit a specialist and the bill is $200. You pay this amount in full. until you meet your deductible, which is set by insurance plan, let's say $1,500. Once you fill up your deductible, that is, spend $1,500 on healthcare in a given year, your future services will involve co-insurance and co-payments. For example, you have a surgery costing you $5,000 and you get 20% co-insurance. You pay 20% of that, which is $1,000, and your insurance covers $4,000. Once you hit your out-of-pocket maximum set by the insurance company, for example, your maximum is $4,000 and you have spent it all, then your insurance covers 100% of your covered medical expenses for the rest of the year.
It's as if the system is purposefully complicated, trying to extract money from you at every single step. There are different insurance providers and different variations of plans and premiums, so you probably need to have a PhD to figure this thing out. Let us know in the comments if we've missed something important in this brief overview.
So what I really want to know with all this is, what do Americans end up spending at the end of the day compared to Canadians?
So, here's what we have based on our income tax dollars going towards healthcare. This is how much we pay for public healthcare via tax, approximately. We won't be doing currency conversion for this, but we will put the average incomes next to it because that's more important. In the United States, healthcare costs account approximately for 9% of the average salary. In Canada, healthcare costs account for approximately 10% of the average salary. So this is actually the first thing that surprised us. I didn't realize that both Canadians and Americans pay the same proportion of their income tax on public healthcare. I was under the impression that the public healthcare spending is way less than in the US. So with that, it becomes rather apparent how much better, looking purely at the cost and the initial benefit, the Canadian system is.
Americans give away 10% of their salary, and some don't even get to use the medical system. And even if they do, there are still substantial out-of-pocket expenses and conditions to meet.
An average hospital stay costs $13,000. You will still likely pay $6,000 out of pocket. A childbirth in America will cost anywhere between $15,000 to sky's the limit $1,000. If you have a good insurance, then you'll still pay at least $3,000.
In Canada, you pay the same percent, but actually get to benefit from the system substantially.
You need a visit to the doctor?
Covered.
Require an emergency care?
Covered.
Need a complex surgery?
That's covered too.
From routine checkups to cancer treatments to maternal care and major operations and hospital stays, if the doctor says you need it,
you don't pay a cent.
Americans pay about the same amount of tax money on public health care, but they receive way less in return. They still have no choice but to rely on private health care.
Now, there is another big part of the equation we must look at before we make final conclusions.
Benefit.
In Canada, wait times consistently rank as one of the biggest issues.
I remember when I was moving to Canada, someone living in Canada at the time told us,
"In Canada, you will only get proper medical attention and good service if you're about to die or if you're delivering a baby."
And that turned out to be pretty much accurate. While emergency care is generally fast, non-urgent care can involve significant delays. If the doctor decides that your case is not urgent, you might wait months, if not years, for an appointment. And even these supposedly fast emergency services are put under immense pressure. There are reports of people dying in emergency rooms simply because there are not enough doctors to take care of them.
A recent study has shown that an average wait time to see a specialist, provided you have a GP referral, is 15 weeks. That's nearly 4 months. And it takes another 15 weeks just to receive the treatment.
Since the entire healthcare system is publicly funded, it is also restricted by the amount of funds it gets. So there is a cap on doctors, cap on hospitals and equipment. If we oversimplify this, our healthcare is limited by the amount of tax that we're willing to pay. Would you be willing to pay more tax to get a better quality healthcare?
The doctor and nurse shortage is a major challenge in Canada, particularly in rural areas. 92% of doctors practice in urban areas in Canada, live in rural communities with a limited access to adequate medical care. Medical professions routinely report being overworked and burnt out. What kind of quality care can they provide if there isn't an environment where they can even take care of themselves?
This is the quality part of the equation. Long waiting times and overworked medical staff. All that plays into a scary trend. Life expectancy in Canada has fallen for 3 years in a row from its peak of 82.2 in 2019.
The American system, on the other hand, does not routinely have the same issues. Doctors, hospitals, and clinics are privately funded. They are businesses, and that means they largely operate like businesses do. They maximize their profits.
With that, medical bills is the leading cause of bankruptcy in the US. 40% of all bankruptcies are associated with medical debt. Even those who have insurance still face substantial out-of-pocket expenses. 8% of Americans are uninsured, and 23%, that is, every fourth American, is underinsured, meaning that even though they are insured, their out-of-pocket medical costs are way too high for their income.
This leads to people delaying or skipping the necessary care. The system's complexity also creates problems. Navigating insurance plans, coverage details, and billing requires a PhD.
But here's where the paradox is. If you have a good insurance plan and have a high income, American healthcare can be excellent. Americans are known for high level of healthcare innovation. Take Texas Medical Center in Houston, for example. It's the world's largest medical research complex. This is the place where the world's first artificial heart transplant was performed, paving the way for the whole new era of surgeries. This medical center serves as one of the world's leading cancer and neurological treatment centers.
While Canada has a cap on equipment and medical staff budgets, Americans have access to groundbreaking innovations provided you have the money.
There are over 1 million physicians in the US,
while in Canada there are about 100,000.
That translates into much better doctor-to-population ratio, which in part results in some of the world's best wait times to see a specialist.
So if you have money in the US, you will get a world-class treatment.
If you don't have the funds, you'll be stuck begging insurance companies for pennies.
In Canada, no matter how thick your pocket is, you get the healthcare you need. It may take months to see a doctor or get the procedure you need, but you will get it, if you live long enough.
In Canada, having extra cash will not get you the world-class treatment in most cases, but it will give you an opportunity to come to the US to seek that world-class treatment.
Which of the two countries is better in terms of healthcare?
It's not a straightforward question. Statistically, Canada generally achieves better population health outcomes, with the life expectancy of 82 years compared to 77 in the US. Canadian infant mortality rates are also lower, 4 deaths per 1,000 as opposed to 5.6.
However, the US does lead in several areas, like cancer survival rate. It may seem a marginal couple percent, but it's not, because every life matters. US has a much higher per capita availability of diagnostic imaging scanners, which shortens wait times for diagnostic and potentially contributes to better outcomes for a wide range of conditions.
But to enjoy these advantages, you'll need to have a pretty big bank account.
So, what does all this mean in practice?
In Canada, a cancer diagnosis, while devastating, won't come with the added stress of financial ruin. A chronic condition doesn't mean choosing between medication and rent. Emergency surgery won't lead you to bankruptcy. The Canadian system prioritizes healthcare as a right, not a privilege. Your healthcare access isn't tied to your job, giving you the freedom to change careers or start a business without losing coverage.
In the United States, however, the healthcare system excels in offering faster access to specialists, cutting-edge technology, and some of the best survival rates for complex conditions like cancer. For those with robust insurance or the ability to pay, the quality and speed of care can be unparalleled. The US system prioritizes choice and competition, fostering innovation and advancements that benefit patients globally.
These two systems reflect two very different values: universal access versus market-driven care. If you could choose, which system would you prefer?
Let us know in the comments below.
Thank you for watching.
Hey guys, a few closing thoughts. This video took a lot of research, and videos like that are only possible thanks to you, because you subscribe to our channel and you share our videos with friends and give us feedback so we can improve. So thank you from the bottom of our hearts. If you want to learn about all the ways you can support our channel, you can do so by checking out our merch shop and simply subscribing to our weekly newsletter. And I will see you soon.